So today what I'm going to do is I'm going to show how I use micro cannula to help improve the skin quality. And what I'm going to do is to use, this is to clean the area up and to use a cannula approach for these polynucleotides. Okay. Just like any micro cannulas, I tend to select several areas where I can have the small punctures, and then I'll use the cannula to go in from there. And comparing to your fillers, where you really have to go deep, this you can stay as superficial as possible. Your cannula can actually go towards the skin. And what we actually know about where we want to place them is it has to be close to the skin at the subdermal area. As you can see how the cannula is currently here. I don't know whether you can see. You can actually close up and see where my cannula is. And you can see the tip of cannula here as well. So what I'm going to do is to put micro droplets here. I'm using a 25 gauge cannula as I want to show you that even your 25 gauge cannula can work. But if you tend to be quite new with your micro cannulas, you can select 27 gauge because the amount of products that you can squeeze out is limited when you use a 27 gauge, and it's harder to squeeze out. But if you tend to use, get used to cannulas, you can actually select a 25 gauge cannula as well. So what I'm doing is to kind of go around the skin area and deposit micro droplets here on the subdermal area, and then I just move towards the right direction that I want to place them. So for patients, especially if they are afraid of pain, I think this is a good way to help them to sort of get over the fear of having a lot of injections on the face. And I think the pain itself is not the needles that is causing the pain. It's just because the pressure from each injection, the micro droplets that you place there, the puncture itself isn't that much of an issue, but it's the pressure that when you actually place the products in there, patients tend to be a bit more sensitive with it. So I'm working along this side of face, and you can even go to the lateral canthal area with this product and place it slightly there. You can do a micro puncture along this side. Too small poke, sorry. So the other thing that we see comparing the polynucleotides with your HA and also certain other skin boosters out there is that we see a lot of improvements in terms of skin quality in terms of younger patients. But when it comes to older patients, especially with the previous product that uses salmon, we have patients that do not see much of the improvements when they get in older stage, when their skin are drier. So generally, I would suggest using something that has a combination of hyaluronic acid, and with the newest that has mannitol, I think it actually helps to prolong the results as well. So that is of ideal selection for older skin type. But I tend to combine because Plinus has a higher concentration of this products that the polynucleotides that actually does help in terms of, so you can actually combine both as well. And now I'm actually working towards the forehead. There you go. It's quite straightforward because you just kind of have to reach the plane that you want to place in, and then I think you can actually spread it according to where you want to target the area as well. So let's move to the other side.